Hi, welcome to the first of a four-part training series sponsored by the National Consumer Voice. My name is Dr. Sherry Gibson, and I am a licensed psychologist specializing in geropsychology, that is aging and geriatrics. I'm really happy to be partnering with the National Consumer Voice to bring to you a four-part webinar series. The first today focused on person-centered thinking, a primer for families. I am really excited about this opportunity, and I hope that what we have developed will be helpful to you as a family member of a resident and a loved one living in a long-term care community. So the intent of today's training is to expose you to this idea of person-centered thinking and how it impacts your loved one living in long-term care. Also, how do we know when it's working and how do we know when it's not? How can you support long-term care community in their quest for culture change around person-centered thinking? And to bring to light some of the behavioral or nonverbal indicators that can raise your awareness to what might be working or what's not working in the care of your loved one. Across the globe and certainly across our nation, a large number of cases have been reported. Thousands of people have died and millions of people have been affected. But no matter the number, each person, each of us is an individual, which reinforces the need for person-centered care. I think it's critical to define who is family. Well, by definition, family refers to two or more people who are related biologically or emotionally. It consists of individuals who are most meaningful and supportive to an individual. So that could be a blood relative, it could be adoptive parents, adoptive kids, legal guardians, extended family, same-sex or opposite-sex partners, and certainly friends. The person, if competent, and by competent I mean mentally able, if that person defines family, that person defines their family, and they then determine the degree of the family involvement in his or her care. To understand person-centered thinking, we have to go way back in our history to kind of the grandfather of person-centered therapy. His name was Dr. Carl Rogers. Carl Rogers had three tenets of person-centered care, and that was empathy, that is the ability to really understand a person's suffering, and coupled with a desire, an authentic desire to help, was at the core of therapeutic change. And that clients are viewed through a lens of potential, a lens of strength, and that therapists always exhibit positive and non-judgmental regard towards their clients. That person-centered therapy approach has now been evolved and translated into all sectors of healthcare. And so what we know about person-centered thinking is that there are four main tenets, if you will, and that is respect and dignity, that providers listen to and honor the perspectives and the choices of the individual and his family, his or her own family, and incorporates that knowledge into their care plan. Information sharing is also important, that providers communicate with the person and their family, sharing complete and accurate information in ways that are both useful and allow that person and their family members to fully participate in decision making. The third part of person-centered thinking is participation, that the person and their family are encouraged to participate in decision making at any level that they choose. And probably the most important here is collaboration, that the person and family are included in various collaborative efforts to improve both the individual care but also education, service delivery, and program and policy development. These are all very critical, that you as family members have an opportunity to shift systems of care by giving feedback and by collaborating with those systems of care. How do we create a system or a culture of person-centered care? And it starts at the top. It starts at the community itself. Ways that we teach administrators and direct care service staff are to reframe the language in which we approach people, to reframe how we describe people's problems as persons living with a disorder, for example, instead of a disordered person. We have to shift our perspective as care providers in knowing people and honoring what's important to them while balancing what's important for them. I'll talk a little bit more about this later. Also, listening to how residents want to live. This is crucial in how care is provided, because how we want to live and maybe how you want to live may be very different from what the resident wants. And so understanding the residents' values is really important here, as a family member and as care providers. That we're not imposing our views or our ideas on a person's value. It's also about supporting people and making use of the resources they have to live the life they want to live. And by resources, that may be the resources they have internally, their temperament, their resilience, or it may be external resources. Those could be paid formal supports or natural supports. And providing the level of support that assists people in making those things happen. There are 5 foundational beliefs that I think is important for you to know as a family member that supports person-centered care. We have to ask the important question: who is this person and what's important to them? Person-centeredness at its core aims to change common patterns of community life, whereas it fundamentally challenges the practices that separate people into an us and them category and thus perpetuates controlling relationships. One of the ways that we teach person-centered care in long-term care communities and nursing homes is that we have to be active listening to residents. One way that we balance the power is to allow people to talk and for us to be quiet, to listen. Honest person-centered planning also can only come from the respect for the dignity and the completeness of the whole person. In my training as a psychologist, I use a framework of a biopsychosocial spiritual model for understanding the whole person, the completeness of that person. And finally, person-centeredness assists people in defining and pursuing a desirable future that tests the person's clarity and their commitment and their courage to do the things that they want to do to have a meaningful life. I think inherent in long-term care is 2 very important concepts. One is quality of life, and the other is self-determination. What does quality of life mean to a person? And as you might suspect, that quality of life, or how that's defined, is as diverse and as individualistic as we are from each other. I'll share a recent story that came into my life, or an example of this. I have a friend and a colleague. He's 81 years old, and during COVID, he was diagnosed with a metastatic tumor that developed on the back of his tongue. He underwent surgical procedure to remove that tumor. And the recommendation from his oncologist, in order to prevent the possible spread of the cancer, was to not only take pharmacological interventions, but to also initiate a long radiation process. My friend, with the help of his family, decided to go ahead and take those measures of treatment. And about around the sixth or seventh treatment, my friend started having some pretty adverse side effects from the treatment. He became incredibly fatigued to the point that he couldn't get out of bed in the mornings. He couldn't engage in the activities that he really liked to do in his life. And the other part of his side effect was that he lost the taste for food. And to him, this was a deal breaker. He loves food. He particularly likes his dry martini at the end of a day. And losing his taste for food on top of having no energy really caused him to question whether or not the treatment was worth it. So he went to his oncologist and he asked his oncologist, what's the risk if I stop treatment? And his provider told him that if he stopped the treatment, it would be about a 15% chance that the cancer could come back. So my friend consulted with his family, and together they decided that he was going to stop the treatment because he really missed those things in his life, and he felt that quality of life was more important right now. And so they made that decision. So here you see a perfect example of quality of life and what that means, and self-determination to act on behalf of what quality of life is. And embedded in that are these often kind of tensions that come up with care providers between autonomy and the dignity of risk. So there is risk in making a decision, for example, to stop treatment. And that's okay as long as the person is their own decision maker, they can make that decision. As providers, we need to be documenting those decisions and also giving all the information to residents and to families about here's the risk if you choose this decision. And those decisions are critical even now. Decisions to re-engage in society, decisions to visit a loved one if you're able to face to face, taking risks around health and around our own health and the health of others, wearing masks or not wearing a mask. Those are all autonomous, self-determining risks that we take. And as care providers, we have an obligation to document and to be good stewards of the information. So all these things are very germane to long-term care communities, as you can see. As I mentioned before, person-centeredness requires us, all of us, not just providers, but also family members, to understand what's important to an individual so that we can help craft interventions and treatments that are important for their health and safety. I like to think of these as values. I've listed a few here on this slide. So values might be comfort, happiness, contentment, fulfillment, satisfaction. When I've worked with families who might be in disagreement about treatment for their loved ones, this comes up, might come up in your family of adult siblings who have different opinions about how mom and dad should be treated in their care. And one of the things that I do as a psychologist in this kind of situation is I ask the family, and particularly if the client or the resident can also participate in that discussion, what do they know that is the most important thing to them? What is their loved one's value? Is it to be pain-free? Is it to live independently as long as possible in their home? Is it to be able to visit their grandchildren? Whatever that value is, all of our discussions around treatment or interventions or care planning should always come back and be anchored in that person's value. So when you think about your own family and you think about your loved one in long-term care, you might want to consider, what is that person's values? What do you know about them? And you may also want to have a discussion with your family member about their value. Is it that family has always been the value? Is it humor? Is it spirituality or religion? Is it pain-free? Social engagement, communion with others. These are all values that you want to know of your loved ones so that you can help educate staff and nursing home communities, long-term care communities on how best to tailor interventions that will be important for that person's health and safety and important for that person to be a valued member of that community. Family plays an incredibly important role. Sharing your loved ones and family-specific knowledge, values, beliefs, and cultural backgrounds really helps aid in the planning and delivery of care. I can't say this enough. That by providing feedback, for example, to administrators of long-term care communities, can help in developing protocols and important procedures that facilitate communication between family members and staff that honors those unique perspectives, values, and needs of each resident receiving care. So your job as a family member is to educate people, is to let them know what's important. Let them know what is specific to your family in terms of culture and values and beliefs. That really does help. I want to give you an example of a resident, just to kind of put meat on the skeleton, if you will. So we'll call this resident Connie. And Connie's dementia had really worsened. She had multiple chronic health conditions, and recently she required the placement of a catheter. In her sleep and while she was awake, Connie kept pulling at that catheter tube that was taped at her leg. And to protect Connie, the nursing staff attempted to use various methods of distraction, even putting her, positioning her close to the nurse's station to keep eyes on her. They were constantly having to pull her hands away, giving her something to distract her with her hands. Staff just became at a loss as to how to keep her from pulling at the catheter tube. Well, her sister knew something really important about Connie that the staff didn't. Connie had severely sensitive skin. And so her sister let the staff know that. And the staff were able to start treating her itching with an antihistamine cream. And they continued to monitor her closely. But it was that very important detail that changed the way the staff treated Connie, the way that they applied care to Connie. And had the sister not shared that piece of information, had the sister not been observant and knew that maybe something else was causing the behavior, because Connie in her dementia disease process was unable to articulate that, was unable to say, I'm itching, this itches, my skin is driving me nuts right now. Because she was unable to do that, that's where family can step in and provide very important information. This is person-centered care. Recognizing the cause of Connie's scratching is person-centered care. Using individualized interventions is person-centered care. Advocating for someone you love is person-centered care, and honoring that person's preferences is person-centered care. We have tough choices that we're all making during this global pandemic. Communication, as you know, can be so challenging. The way that we're communicating has been turned on its head. Some of the resources that you'll want to visit for sure is through the Long-Term Care Ombudsman Program. And I've listed some links here to locate your local program. Also, the National Consumer Voice website has some wonderful resources for families. I want to encourage you to stay connected to your loved one through the very simple means of phone calls, video calls if possible, cards and letters and window visits. Those make a great deal in preventing loneliness among nursing home residents. Loneliness is a complicated issue, and it affects a lot of aging people right now. It's been directly associated with early mortality and worsening health conditions, and certainly either worsening psychological conditions such as depression or anxiety. They can be exacerbated or they can develop because of loneliness. So using all the resources in your toolbox will be helpful during this time. Also providing statements of encouragement and listening with a fine-tuned ear for signs indicating any kind of emotional distress or physical decline in your loved one, and communicating that back to the community. Also, you can always contact your local ombudsman if you're unable to communicate, or if those lines of communication isn't readily available, or there are other barriers. You can reach out to your long-term care ombudsman and they can advocate for your loved one. I like to use the metaphor here of the lotus. The lotus is a very delicate, resilient flower that grows from a very adverse, seemingly adverse environment, usually from mud. And it reminds me now about the adversity that we are all faced with. And through adversity, we know that resilience is bred, and it allows opportunity for personal growth. It allows opportunity for creativity. The one thing that I'm seeing across this country, especially in long-term care communities, is creativity, ways of figuring out how do we think about connection? How do we rethink engagement? How can we be better stewards of that within this very adverse, muddy environment? Person-centered thinking is a strength-based philosophy of being with people, not doing to people. It creates systemic change that reverberates across all levels of care and ultimately affects your loved one and you. Person-centered thinking, just so you know, isn't just for professionals. It's for all of us. We don't just clock in at our jobs and we become person-centered care providers. All of us can be person-centered thinking. It's something that we embody. We use it in the way that we communicate with our family members, our neighbors, our teachers, our grocery store clerks, our baristas. Remember coffee shops? Weren't they great? So you can make a difference here. You can model what person-centered care is. And you can also remind the people who are providing care about the unique differences of your loved one and helping create a better care experience and helping create a life with meaning and with quality. I've provided here some resources through the person-centered care and trauma-informed care, both through the Consumer Voice and through the National Long-Term Care Ombudsman Resource Center. All of these are available to you as families, and I strongly encourage that you check them out. I've also listed here other ways that you can connect with those organizations through their websites, also through social media. And I want to thank you very much for spending your time in this webinar. I look forward to connecting with you on the next 3 webinars, and I wish you the very best. Thank you.